Why we want to use nitrous oxide? We want to decrease or eliminate anxiety. We want to decrease untoward movement and reaction to dental treatment. We want to increase the communication in the patient cooperation. We want to increase the pain reaction threshold. We want to increase that. We want to increase the tolerance for longer appointments. Again, maybe more adult dentistry. We want to decrease the gag reflex. And we want to potentiate the effects of other sedatives when we are using or when we are doing oral sedations with maybe benzodiazepines like midazolam. We want to potentiate the effect of the benzodiazepines when we use nitrous oxide. Now, like everything in life, not everything is perfect. There are some disadvantages of the use of nitrous oxide. Number one, it's not very potent. We know that from the front. It's highly dependent on the psychological reassurance. So that means that we need to explain to the patient, we need to tell the patient that nitrous oxide is actually a good helper, but it's not going to put the patient to sleep. Sometimes one of the disadvantages of using the nitrous oxide is the interference of the nasal hood with the injection to the anterior maxillary region. So that's the reason, and I will show you some pictures in a few minutes about different nasal hoods. So we want to try to use the one who is less prominent, because the ones who are really prominent, they are going to interfere with the injection. The patient must be able to breathe through the nose, obviously, and the nitrous oxide pollution and potential occupational exposure hazards. So the technique for nitrous oxide administration, this is my general points. 2 happy phases. Number one, the use of scavenging systems that remove the nitrous oxide during patient exhalation is critical. That's probably the best way to decrease the amount of nitrous oxide around the environment. Select a properly fitted mask size for each patient. So if you work with children, make sure that you use a nasal hood for children. If you are working with adults, you use a nasal hood for adults. The next is also a happy phase. Even if I don't have a happy phase, there is a happy phase. Titrate the concentration of nitrous oxide. What is the meaning of that? That's really what kind of pays your time coming to my webinar. When I'm using the nitrous oxide, make sure that I explain to the patient that the patient is aware how critical it is to keep the nasal hood around the nose. Then I explain a little bit how the patient is going to feel. I like to tell the patient that a little bit sleepy, and then I start slow to open the concentration of nitrous oxide. It's not a good practice to jump into 45. The perfect scenario is you go 10% nitrous oxide, 15%, maybe 25%, and you wait at least 1 minute, 1 minute and a half in between the different concentrations. I cannot tell you enough how critical it is to titrate the concentration of nitrous oxide. In some patients, we need to have a med consultation. Patient with severe COPD, congestive heart failure, sickle cell disease. It's not a good idea to use nitrous oxide in patients with acute otitis, patient with a recent tympanic membrane graft, or patient with an acute severe head injury. I think so it's common sense. All these are common sense to have either not use nitrous oxide or have a consultation with a physician.